My name is Nori Riccio. I'm the program coordinator for the radiation therapy program here at Manchester Community College. Today we're going to be talking about what radiation therapy is and how it's used, and we'll also talk about the educational requirements to become a radiation therapist. Radiation therapy is one of two tracks of the radiologic science program here at Manchester Community College. When we're using radiation therapy, we are using high energy X-rays and radioactive materials and other sources of ionizing radiation to treat disease. That disease is primarily cancer. What you're looking at in this picture here is an inner workings of our machine that produces the high energy X-rays called a linear accelerator. And then you're seeing a cross-sectional view of a patient. The goal is to treat this red area, that will be the target, and then we can actually manipulate the equipment to go around the patient to minimize those normal structures and to maximize the dose to the tumor. So what is cancer? They're abnormal cells dividing out of control, and they are able to invade other tissues. It can spread to other parts of the body through the blood and the lymph systems. There are many different kinds of cancer. For instance, even breast cancer, if we take a look at breast cancer, it is treated very differently. Some of the ways that we can treat cancer, one of them is surgery. And that is a primary way of treating cancer, and it does treat locally. We can also do chemotherapy, which is systemic treatment, and then radiation therapy, which is also localized treatment. So we're only affecting the area that we're actually treating. Many times, cancers are being treated in many different modalities. The goal of radiation therapy, being a localized treatment, is again to maximize that dose to the cancer cells and to minimize the dose to the normal structures. We know that radiation can damage the cells in the body, so we take a lot of time and care to make sure that we're not getting any extra radiation to those normal structures. We do treat patients 5 days a week, and the patients will come to us for about 4 to 7 weeks. So as a radiation therapist, we have a lot of patient care, and we get to really know our patients, even though we're seeing them for a short time a day. Radiation oncology team does include the doctor, the physicist, a dosimetrist, the radiation therapist, the nurse, the dietitian, social worker, just to name a few people. Our role as a radiation therapist is we specifically give that prescribed dose of radiation to the patient. Much like you're going to take a prescription if you have an infection that the doctor would prescribe for a week to 10 days, we also give radiation that the doctor prescribes. So during the actual treatments, the doctors are not in the room with us. It's the radiation therapy who are actually delivering the treatment. So it does require a very high degree of patient interaction and care, and we are using very sophisticated computerized equipment. The process of radiation therapy, if somebody needs to come for treatment, the first step would be to see the doctor and during the consultation. And the next step would be simulation, treatment planning, and treatment. So once the patient says, yes, I want to have treatment, the first step is the simulation. This is where we're going to actually map out the area that we're going to be treating. We'll also create different devices and mobilization devices to help the patient hold still. So you can see that in the room here, there is a piece of X-ray equipment, a CT scanner, that we can image the patient in the proper position, and we'll get those images to then create a plan. During the simulation process, we can also use other kinds of images, such as MR or ultrasound, to help localize that tumor and make sure that we are finding exactly where that tumor is. Once we've taken those X-rays and created that, we have all the X-rays that we need, we then will make temporary or permanent marks on the patient, so the therapist can identify those fields. Now, when I say permanent or temporary marks, we actually call them tattoos. So I'm sure that me saying the word tattoo conjures up some kind of image in your mind of an actual large tattoo. But if you look at this patient's arm, or this person's arm right here, you can see a series of freckles. At least that's what it appears like from looking a little bit further away. If you look a little bit closer, you'll see one of the freckles is a little bit different color. This is an actual tattoo. So this is what we do with our patients. We'll actually tattoo them, and then we are able to use those tattoos to align those The next step after the simulation is done is the treatment planning process. We actually will send all the images that we're taking during simulation to the computer. A dosimetrist is a person who actually does the planning. They work off of the doctor's instructions. They do work closely with the doctors and the physicists. They do have additional training and have taken boards. So this is something that radiation therapists can often advance into. So this is an example of the dosimetry computerized plan. You are looking at a cross-sectional view of the patient. The red is the area that we are trying to treat, and then the blue-green area is the area that we are going to come in with the different angles of the machine. Another example of a treatment plan, this is a brain. We can again outline those normal structures. So we can outline the eyes, the brain stem. So you're looking at this alien-like structure here. The eyeballs are right here. We have the optic nerve. We have our brain stem. So again, we are going to design a field of radiation that will miss those critical targets. Somebody goes to get a chest x-ray and they have something that shows up on the chest x-ray. This particular patient had this chest x-ray that had subsequent follow-up images and biopsies, and then needed to come in for radiation therapy treatments. So we can design a plan through the simulation process and the treatment planning process, and create a plan that will treat the area. This red area is where the tumor is. And you can see these various lines that we call isodose lines that shows us where the radiation is going. And we can look at a side view and again showing us where the radiation is going. The blue is the spinal cord that we're trying to avoid radiation to. So when they're creating the plans, they will make sure that the dose does not go over the required amount to make sure we're protecting those normal structures. Once the plan is created, it does give a series of numbers that you're seeing at the bottom of this screen. And those series of numbers is what we would actually use to set the parameters in the actual treatment area. What you're seeing in this image, the pink is the long outlined, as is the green is a long outlined. The red is the area that we are treating. We can block some of that normal tissue out with special blocking devices in the machine. As another example of a treatment plan, looking at it a little bit differently. This is a cross-sectional view of your chest area. And again, the radiation beams are coming in from the front of the patient on this particular patient. So we design different radiation plans to fit the needs of the patient and to make sure, again, we are not treating the normal structures. Once we have that plan, the next step is to actually give them the treatment. So our job as a radiation therapist, we do work in pairs together in the treatment room, and we will set them up according to their instructions that's prescribed by the doctor, and that was done in the simulation. So you can see that there is a laser system, and in this image also you can see the laser system. So we will align the tattoos to that laser system and make sure they're nice and straight. What we also do is check and double check the devices that we're using and the instructions that are given to make sure that everything is meeting what the prescription says and what the treatment plan says. We also then can image the patient to verify their position. And these are some different types of images that we can take to verify that position. And then once everything is verified and double checked, we can then actually give the actual treatment. We can never be in the room when we're actually giving the treatment. We have to be outside of the room because it's such a high energy machine that we need to be outside. We are always, though, monitoring our patients. We can see them on cameras, and we can also hear them, and we can also speak to them. So this is the console area that we will administer that radiation. So when the radiation is actually being administered, we can't see the radiation, you can't feel the radiation, but you do hear the machine humming. What I'm going to show you now is a sample of our virtual environment of radiation therapy. This is an amazing tool that we have on campus that literally is the virtual environment, has the same controls that we have in the clinical setting. In this particular treatment, you will see in just 1 minute that the actual radiation beam is moving around the patient. And we can actually see that that beam is changing, and you can notice that in this square here, we can see the anatomy. The blue and the green are representing what the area is that's being blocked. You can see the anatomy also on this patient. The different structures that you're seeing here that are highlighted are the different structures. Some of them are the tumor, and others are normal structures that we're trying to avoid. So this is a great tool for us at MCC that we can use this tool to educate our students. Once the treatment is delivered, other things that we need to be careful of or watch for are side effects from the treatment. Again, the doctors and nurses are not in the room with us when we're giving the treatment. That is our job and our role. So it's also our role to make sure that the patients are doing well, to make sure that they're eating, and to monitor them for side effects. If they are having any side effects, we will refer them to the appropriate healthcare professional. What we look for as far as the qualities of a radiation therapist, you need strong interpersonal communication skills. You need to speak to patients, you need to be able to write. So it's very important that we can relay information appropriately and timely. You need to be compassionate and sensitive to others. You also need to have a sense of teamwork. Working collaboratively is imperative in the healthcare system. And you need to be very careful, precise, and very responsible. The admissions process, first step is attending an information session. You also need to submit an MCC college application. You need to submit an MCC health professions application specific to radiation therapy, and then also submit your high school transcripts and your college transcripts. The admissions process in radiation therapy does have prerequisite courses that you need to have taken out of college with a grade of C or better. So public speaking, English composition, anatomy and physiology, 2 semesters, and that needs to be taken within the last 5 years, and pre-calculus also taken in the last 5 years. Other courses that need to be taken, general education courses for your associate's degree is psychology and also an arts elective. Other courses that are recommended prior to the program but are not necessary is the medical terminology, concepts of chemistry, or introductory physics. The concepts of chemistry is actually a prerequisite to A&P 1 and 2. Once you have the prerequisites and you've completed your application, then we will schedule you for an observation in the radiation therapy department if you're meeting the prerequisite courses. And then after that, you will be scheduled for an interview. And final acceptance in the program does require a pre-enrollment physical exam screening that includes immunization, substance abuse screening, and background checks. This is required by our clinical sites. This is not required by MCC, but for any student to go to the clinical setting, you have to pass their requirements. When we're looking at accepting students, we are looking at the applicant's GPA. We also need to look at the prerequisite course scores or grades, and also the clinical shadow and interview. Once students are accepted in the program, there are some additional fees that could include CPR, background checks, immunization tracker, professional memberships that actually contain some educational content that we use. That probably approximates about $250. Some clinical sites do require you to pay for the parking. Our timeline, applications are due February 1st, so this would be next February in 2021. And then we would have interviews in April, and then you'd be notified in May. And then we'd have orientation in May and June, and then classes would begin in August. The program is 5 semesters in length. It does begin in the fall semester once per year. You are required to attend a summer semester and then also attend 2 winter intersessions. Those winter intersessions are included in the spring semester to avoid additional costs to the students. You are in the program 40 hours a week. So class or clinical, 40 hours a week. And the first year, you're in class Monday, Wednesday, Friday, in clinic Tuesday, Thursday, and then the reverse is true for the second year. This 40 hours a week does not include study time, so that is additional time you will be studying. Students rotate to multiple different clinical sites. We are very fortunate to have a myriad experience for our students, give you a very well-rounded background in radiation therapy. And students will rotate to different sites per semester, and it is the faculty who schedule that. It is your responsibility to get that transportation, though, to those clinical sites. You do have career opportunities and advancement opportunities. Most of the time, the radiation therapy departments are in hospitals, sometimes in small clinics. And you can certainly get advancement opportunities in dosimetry. You can go back to school for additional training and take your boards for that. You could also do supervisory administration. You could also move into the physics role or education role. You need your master's degree for education. And you can do application specialists, which are people who are teaching others how to use equipment. So the job market, currently the U.S. Department of Labor Statistics states that the median pay is a little over $85,000. So that is not your entry pay. That's after you've been working for a few years. There is a faster than average job outlook, and it is a competitive job market. Once students graduate from our program, they then need to apply to sit for a certification exam. It is a national certification exam, so once you pass this exam, you can work anywhere in the country. You do need an associate's degree to take this exam. And again, you are eligible to apply to take that exam for radiation therapy once you graduate. Fortunately, we have a very great pass rate. So first attempt is 97%. All our graduates pass that exam. And if they don't pass on the first attempt, they take it again, and we have a 100% pass rate for that. We also have a 100% employment rate. If you need additional information, please don't hesitate to contact me, and here is my contact information. Welcome to MCC, and I hope to hear from you in the future.